Assalamu alaikum. I hope you're all doing fine. I am Dr. Muhammad Ali Rabbani and I will be discussing with you the next lecture in the series of cross anatomy of upper limb, that is the osteology of scapula. Okay, let's start with our lecture. As you know, we have already discussed in the previous lecture, the scapula is one of the two bones that form the pelvic pectoral girdle, that includes clavicle in front and scapula behind. So this is the bone of the girdle. It does not form any bony joint with the axial skeleton. It makes two joints that we will see. These include the joint that it makes with the shoulder, that will be the shoulder joint. The joint it makes with the humerus, that will be the glenohumeral joint. And the joint it makes with the clavicle, that is acromioclavicular joint. Okay, let us isolate this bone and discuss its feature. This is a bone, plate-like bone, that is triangular in shape, and it has three borders like this. This is the superior border. Let me. Okay, it has three borders. Superior border. This one will be the lateral border, and here is the medial border. I will go into a little more detail as I go on. It has three surfaces. The one that you see in front of you, that is the anterior surface. The one you see in the back, that is the posterior surface. Between the three borders, you have the three angles. This is the superior angle. Between superior and medial, lateral and medial, this is the inferior angle. And between these two, this point is the lateral angle. So these are the three angles, the three surfaces: superior, medial, and lateral borders, superior, inferior, and lateral angles, anterior and posterior surfaces, and it has three processes. This, the one that is projecting anteriorly, this one, this is shaped like a beak of a crow, that is called coracoid process. That means exactly that. The one that is extending backwards, this whole shelf-like extension, this is this whole shelf-like extension, this is spinous process, and extending from that, this whole thing, this is the acromial process. So this is the basic overview of the scapula bone. Let us start in detail. Like all the other bones that we discussed, we will start with side determination. For the side determination, again, you need to know about all the three axes: what is anterior, what is posterior, what is superior, what is inferior, and what is medial, what is lateral. Let us start with differentiating between anterior and posterior surface. The anterior surface is concave, as you might be able to appreciate in a slightly different view like this. You can see it is dipped inwards, it is concave. So this is the anterior surface. The posterior surface is very easy to differentiate. It is not only it is convex, it is divided into two parts by this subscapula, this spine of scapula. By this, it is divided into two parts. This, the part that is the fossa that is formed above it, is called supra, because it is spine. That is supraspinous fossa, and below it, this is infraspinous fossa. So the posterior surface can be easily identified with the help of spine. Anterior surface is concave, that is subscapular fossa. We are done with anterior and posterior. Superior and inferior are easy to identify. That inferior one is made up of this angle. This is the inferior one. This is the inferior end. And the superior one is containing this surface and these projections. So this is the superior one. So this is the superior end. This is the inferior end. So we have anterior and posterior, superior and inferior. Now we are left with medial and lateral. The one, this whole cavity that forms the shoulder joint, that is the lateral one, that is the glenoid cavity, that is the lateral end. This whole margin is the medial end. So if we take all these things into account, you can see that this is the bone of the right side, as the humerus will be attached here. So this will be the right scapula. You can compare it with the you can compare it with the, sorry, scapula on the other side. Let me change the view. You can see from this view. Let me remove the muscles. So these are the two scapula. This is the right scapula with the glenoid cavity towards the right side. This is the left scapula with the glenoid cavity on the its left side. So that is why we use the words lateral and medial rather than using the right and left. So this is the scapula. Let us go through these structures one by one. Let us start with the borders, then we will move and discuss the angles and then the surfaces and then the processes. So, the superior surface, the superior border, I'm sorry, the superior border. The superior border is roughly horizontally running. It is narrow, sharp, and it has one very interesting thing about it, that near the end, near its lateral end where it is joining with the base of the coracoid process, there is a dip, there is a notch. This is the notch, this notch. This is called suprascapular notch. This is the suprascapular notch. That is a bite in the bone, that's a notch in the bone, that is a suprascapular notch. And it has a ligament that is traversing this notch. It is called supraspinous ligament. This is supraspinous ligament. I'm sorry, suprascapular ligament. This is the suprascapular ligament that bridges this notch, and it converts this notch into a foramen. See, this is the suprascapular ligament or transverse ligament. This that is in the notch. This is the superior border. Then there is this lateral border. Lateral border runs between the superior angle and the inferior angle. It is again sharp in nature, and it runs from the two angle, and it runs along the medial side. Not much to go around here, not many features to differentiate, but the thing to remember, it's thin and relatively sharp in nature. That leaves us with the lateral border. This is the border that is relatively quite thick. You can see in this angle, uh, like I'm looking from the lateral side. So you see it is this thick. It's like a rod. It's The lateral border is thick, and it extends above from the glenoid tubercle, from the glenoid cavity all the way down to the inferior angle. This part just before the glenoid cavity, this part you can see it's a little prominent. This part is a little prominent. This part is a raised area, so it is called tubercle, and it is below the glenoid cavity, so it is called infraglenoid tubercle. So this is the infraglenoid tubercle. So this is the lateral border. It runs between these two glenoid cavity or infraglenoid tubercle to the inferior angle. Now talking about the three angles, the superior angle, it's between the two superior and medial margins, and it is covered by trapezius. I will show you the muscles as I go to the attachments. The inferior angle is between the lateral and medial one. It is covered by latissimus dorsi. Just to help you memorize, I will write them down. This is covered by trapezius. We will shortly see them as we move to the, and it is covered by latissimus dorsi. So these are the two angles, and the third angle is the glenoid cavity, and it has a tubercle raised area on the inferior aspect that was called infraglenoid tubercle, and it has a similar raised area on the superior aspect also. So this part is called supraglenoid tubercle. These both serve as attachment of the muscles as we will see them shortly. So these are the three angles. Let us look at the surfaces. The surfaces, the surface that is anteriorly or ventrally, that is the anterior surface or subscapular surface. Costal surface also, because it is adjacent to the ribs that is in front of them. So this is known as costal surface or anterior surface or subscapular surface, because if you look at the scapula in a little anatomical position, you can see that scapula, it's little tilted anteriorly like this. It is tilted anteriorly, so it's not like this, it's somewhat like this. So this surface is technically below it a little also, in just apart from being in front of it. So this is also called subscapular fossa, anterior surface, costal surface. Okay, this surface, as we have already seen, it's concave in nature, as you can appreciate by looking at it from different angles, and it has these horizontally running lines, longitudinally running lines, like this one, this one, this one, and this one. That is due to the attachment of the muscle and the part where these muscles are attached. So these are the muscles, and these are the ridges, longitudinal ridges. Let's go to the dorsal surface. The dorsal surface is convex in nature, as you can see from this angle. It is convex in nature. It is convex in nature like this. It is convex in nature, and it is further divided into parts by this spinous fossa. Spine. This is called supraspinous fossa. This is the fossa that is above it. That is below is the infraspinous fossa, and between the two, there is a connection right here, right here. So the arteries and nerves that are present on the upper aspect can continue downwards from this area. So this area, due to this region, this is the glenoid cavity, this is the spinous process between this is called spinoglenoid notch. So this is spinoglenoid notch. So that is between them. Now we come to the processes. This is the one that is in front of you, that this triangular, this is the spine. The spine is triangular in nature. It has three borders and two surfaces. And the three borders is one attached border, one free border that is making the spinoglenoid margin, and one is this one. This is the free margin. This is the free margin that we see. This is known as this is known as crest of the spine, and the crest of the spine is very thick, and you can see it's relatively sharp upper lip and lower lips. We will see them again, and the muscle attachments. So it's triangular in nature, and three borders and two surfaces. One will be towards the supraspinous fossa and one will be towards the infraspinous fossa. So these are the three borders, two surfaces of the spine. The part that extends beyond it is the acromion process. You can see it is flattened above downwards, expanded side to side. We are looking from it from the back, and on the tip, it has the articular facet that helps it makes the joint with the acromioclavicular joint. So, if we get it in the anatomical position like this, if we look at the acromion process, you will see that it is flattened from above downwards, expanded from side to side. So you will see it has the two surfaces. The one that is on the top, that is the superior surface. The one that is on the bottom, that will be called inferior surface. The borders on this margin will be the medial border, and here it will be the lateral border. So these are the surfaces and borders of acromion: the medial border, the lateral border, the superior surface, and here is the inferior surface. And on the tip, you can just see this. This is the facet that will make the joint with the clavicle, the acromion end of the clavicle. So we are done with the two processes, the spinous process and the acromion process. The next one will be this project that is like a beak of a crow, that is the coracoid process. This is the attachment. This area is the base, this is the free end of this process, and you don't need to worry about many surfaces. Okay, but I will just go through them again. So it is basically a type of joint, the type of epiphysis. In other animals, in evolutionary lower animals, it was an independent bone. But in this epiphysis, this center of ossification is fused with the rest of the clavicle. So it is known as atavistic. Atavistic. It is an example of atavistic type of epiphysis. So it fuses with this. Okay, so this is the whole of the clavicle. I discussed the different borders: superior, medial, lateral. The lateral one was thick. Three angles: the lateral, the superior, the inferior. The lateral one was having the glenoid fossa with superior and supra and infraglenoid tubercle. Two surfaces: the anterior one, the subscapular, and the dorsal one, that was divided into supraspinous and infraspinous. And the three processes: the spine of scapula, the acromion process having superior inferior surface, two borders, and the facet, and the coracoid process. So let us move on to the attachments. For the attachments, I will move to this model. Let me move to this model. Okay, I will be talking on the right scapula. So this is the right scapula, as you can see through the ribs. So it has different muscle attachments. Let's start with the ventral anterior surface. As you can see, most of the anterior surface, most of the subscapular fossa, it is covered by the origin of the muscle that is known as subscapularis muscle. Then muscle name is the same as that of the fossa that is housing it. So it is basically arising from this fossa and getting inserted into the humerus. We will have the exact details as we move along with the muscles. So this is subscapular muscle. Rather than going, I will show you the other muscles that are going from scapula to humerus. These include the muscles that are on the back, the one that is in the supraspinous fossa. It is usually mostly origin point is focused on the medial aspect towards the spine. This is a supraspinatus muscle that originates from here and goes, and it is from the supraspinous fossa, it goes and inserts into the humerus. This is a supraspinatus muscle. Then there is the origin of infraspinatus muscle. It covers most of the infraspinous fossa, mostly focusing on the medial aspect. It is mainly in other books, especially in the Netter's Atlas and other books, you might see this area not labeled. So this is the infraspinous fossa, housing the attachment of insertion of origin of the infraspinous muscle that gets inserted into this humerus, and that leaves us with this teres minor muscle. The origin of teres minor muscle, it also gets inserted into the head of the scapula. So this teres minor, infraspinatus, supraspinatus, and head subscapularis. These four muscles, they get inserted to the head of the humerus. These are called rotator cuff muscles because they cover the head of the humerus from all the sides. Like supraspinatus is covering it from the anteriorly, then as you move along, supraspinatus will be covering in from superior aspect, infraspinatus from the posterior aspect, along with the teres minor. So all of these muscles are the muscles of rotator cuff muscles. So these four muscles we have discussed. Okay, let us see the next one. On the ventral surface, as you can see this blue line across the medial margin of the anterior surface. This one. So this is the origin site for the serratus anterior muscle. Let me highlight this for you. If you pick this muscle, this is the muscle that is a little difficult to grasp in 2D models, but fortunately we have the ability now to use the 3D visualizations, and you must have models and dissections in your institutions. We will be talking about this. Let me zoom out. Okay, so this is the serratus anterior. It originates from the medial margin of the scapula and it hugs around, rotates around the ribs and gets inserted into the first 8 ribs. So this is the first, second, third, fourth, fifth, sixth, seventh. I mean first, second, third, fourth, fifth, sixth, seventh, eighth. So it gets attached to the 8th ribs. It does not mean serrate, does not mean 8, but it's easy to remember serrate 8. So it is the one that is helping to move the scapula. As we will discuss the muscles, we will discuss its function. But one thing that I want you to pick up here is that this is the one of the major muscles that is keeping the scapula pulled towards the ribs. So this is one of the muscles that has pulled the scapula towards the rib and it keeps it in that position. So if this muscle for one reason or another it becomes non-functional, then scapula gets a little away from the oh, scapula gets a little away from the ribs. So as compared to the, if this muscle becomes paralyzed, the affected scapula, where the serratus anterior is not working, gets a little further from the rib cage as compared to the healthier side. So this is called winging of scapula, because if you ask a person to put both of the hands in front of the wall and push, this muscle in the normal circumstances prevents scapula from being displaced backwards. But this does not happen if this muscle is non-functional. So this is serratus anterior. It is attached to the medial margin on the ventral surface. So these are the muscles we can see on the anterior aspect. I will move to the processes shortly, but let us cover the borders and the posterior surface first. Here, this is a small part that you can see. This is the part, the superior margin. It gives attachment to one of the muscles of the neck. This is the infrahyoid muscle, omohyoid muscle, sorry. It starts from this hyoid bone and goes all the way and attaches to the superior margin of the scapula. This is the infrahyoid muscle, sorry, omohyoid muscle. That is the one of the muscles of the neck that starts from this bone, the hyoid bone, and it's get from the hyoid bone. It goes all the way to the scapula. How does it makes two bellies? Where does the bend occur? It's not the scope of this particular lecture. So these are the muscles that you can see from the front. Let's go to the back. You were introduced to the two muscles like this, the supraspinatus, infraspinatus, and teres minor. Now we are left with this muscle, that is the supraspinous fossa, infraspinous fossa. The lateral margin on the dorsal aspect houses two muscles. The one that is above, that is the teres minor. It gets attached to the head of the humerus, and then what is below, that is the teres major. It gets inserted to the shaft of the humerus, to the anterior surface of the shaft of the humerus. This is teres major. Some books also mention latissimus dorsi. Latissimus dorsi, it is not shown very well in this particular picture. If it is a big muscle that starts from the back, lower back, and goes all the way to insert into the shaft of the humerus, it has some fibers that may insert into the lower angle of the scapula. Let me show you the latissimus dorsi. So this is the latissimus dorsi, a big muscle that is originating from the back and goes all the way here. It covers the lower border of the scapula, the inferior angle of the scapula, and then it gets inserted into the shaft of the humerus. As you can see, right here. So this is latissimus dorsi. Let me remove this muscle and the other muscles for that matter too. Okay. Now that brings us to the medial margin of the posterior surface. From the medial margin, you can see it is giving attachment to the three muscle. One from the superior angle all the way down to the base of the spine. Second, at the level of the base of the spine. Third, below the base of the spine all the way to the inferior angle. So the muscle that is arising from this superior angle to all the way to the base of the spine, that is called levator scapulae. It arises from the neck above, and as you can see from its direction, it elevates the ribs in this direction. So this is called levator scapulae. So levator scapulae originates from the superior angle all the way to the base of the spine. Then opposite to the base of the spine, this is the muscle that arises, that is called rhomboid minor. It arises from the lower cervical and upper thoracic vertebra, and then this muscle that arises from base of the spine all the way down to the angle. Again, this is the medial most margin of the posterior dorsal surface, so this is called rhomboids major. So these are the three muscles that are originating: levator scapulae, this the rhomboids minor, this the rhomboids major. This brings us now to the processes that are giving origin to the different muscles. Now, the spinous process. We talked about the muscle that are originating from the inferior surface of the spine of scapula, from the superior surface of the spine of scapula. So now let's see what muscles are originating from the uh, crest. Okay, which muscles are originating from the crest of the scapula from its superior and inferior lips. So this muscle that originates from the superior lip of the crest of the scapula, this is the trapezius muscle that we discussed, that we saw in the clavicle. So it is attached to the superior lip of the crest of spine of scapula. The same muscle is attached to the medial border of the acromial process. The same muscle is attached to the posterior border of the clavicle, lateral one third of the clavicle. So the superior margin, so the superior crest, it gives origin to the trapezius. Superior margin of the spine of crest of spine of scapula, it gives rise to the trapezius. The muscle that is arising from the inferior margin, this is the one that you have already seen in the clavicle lecture. That is the you're very familiar, the tip of the shoulder joint, that is the deltoid muscle. It arises from the lower margin, and this muscle continues to be attached to the lateral margin of the acromion and continues to the anterior margin of the anterior border of the lateral one third of clavicle. So this is the deltoid. Let me get it back. So this is deltoid. So now coming to the acromion, we have already covered from the medial border and superior surface trapezius, from the lateral border deltoid. This will be the deltoid. So acromion is covered. Now the glenoid, now coracoid process. The coracoid process gives attachment to three muscles, two origins and one insertion. And this the on the lateral margin of the coracoid process, this is giving insertion to the pectoralis minor muscle. Pectoralis minor muscle originates from the rib number uh, 3, 4, and 5, and it gets inserted into the scapula and pulls the scapula downwards, also brings it forward. Then on the tip, there are two muscles that are attached. The two muscles that are attached are the one that is going to the middle of the shaft of the humerus, that is coracobrachialis, and the other one will be the this long, short head of biceps. That will be the short head of the biceps. So if there is a short head, there must be a long head, and the long head of the biceps, as you can trace this picture, long head of the biceps originates from the tubercle on the upper aspect of the glenoid cavity that we picked up as supraglenoid tubercle. So the supraglenoid tubercle gives origin to the long head of the biceps, and that leaves us with the last muscle that is arising from the infraglenoid tubercle, this one, and this is giving origin to the one of the three heads of the triceps muscle, that is the long head. So these are all the muscular attachments of the scapula. Let me go through them very quickly. From the anterior surface, from subscapular fossa, subscapularis muscle. From the ventral costal surface, near the medial margin, across whole of the medial margin on the ventral surface, that is the serratus anterior muscle. From the superior border, just near the notch, that is omohyoid muscle. Going to the back, from the superior supraspinous fossa, there is supraspinatus muscle. From the infraspinatus fossa, there is infraspinous muscle. Then across the medial margin on the dorsal surface, there were three muscles. From the superior angle to the base of the spine, there was levator scapulae. Across the base of the spine, there was rhomboides minor. From the base of the spine all the way down to the angle, there was rhomboides major. Okay. On the dorsal aspect, on the lateral margin. Superiorly, upper aspect, you can see the teres minor. Below it, you can see teres major. And not shown right now, at the lower angle, the dorsal aspect may give attachment to the, this part give attachment to the latissimus dorsi. Going to the glenoid tubercles, there was the one that was below the infraglenoid tubercle. It gives attachment to one of the three heads of triceps, long head of triceps. The supraglenoid tubercle, it gives attachment to the long head of biceps. Okay, now comes to the coracoid process. Coracoid process on the tip, it gives attachment to the coracobrachialis that goes to the middle of the shaft, of the humerus. Then it gives attachment to the second head of biceps, that is the short head of biceps, and the third muscle, that is the insertion of this, not the ligament. Of course, we will talk about the ligament too. That will be the pec minor muscle. Now, the spine of scapula and acromion process. The spine of scapula, it gives origin on the surfaces to supraspinatus and infraspinatus, as we discussed previously. On the crest superior margin, it gives attachment to the trapezius muscle. On the inferior margin, it gives to the deltoid. Similarly, on the acromion, on the medial margin will be the trapezius muscle. On the lateral margin will be the deltoid. Okay, moving on, then we are left with, I think we have completed that. So we are left with the ligaments. Let us start with the joints. The one joint that is formed by the acromion, this is the acromioclavicular joint. So there is the ligament of the acromioclavicular joint and capsule of the acromioclavicular joint that is completely encompassing just behind the articular surface. The coracoid process, as you can well see in this, is getting attachments of a number of ligaments that you have seen in the clavicle also. It is giving attachment to the conoid part of the coracoclavicular ligament, trapezoid part of the coracoclavicular ligament, and this is the ligament that is running between the coracoid process and the acromion process, that is coracoclavicular ligament. Then comes the glenoid cavity. Glenoid cavity has a rim of fibrocartilage that is called glenoid labrum. The glenoid labrum. The glenoid labrum is basically a rim of fibrocartilage. Let me close the muscle there. This is basically a rim of fibrocartilage that circles the articular surface of the glenoid cavity, glenoid fossa, and actually deepens the surface to make the shoulder joint more stable. And then there will be ligaments from coracoid process to the humerus. That will be coracohumeral ligament. This will be the ligament that will be running from coracoid process to the humerus. Let me show you here. This one will be the coracohumeral ligament. Again, the attachment will be near the base of the coracoid process. You might be able to see it well right here. It is giving attachment to the base of the coracoid process. and that leaves us with the capsule of the shoulder joint, that is also known as glenohumeral joint. The glenohumeral joint, it gets attached to the hair. To the scapula, it will be attached across the, just behind the glenoid labrum. It will be attached all the way in a circular fashion. So these are all the attachments of the scapula. And of course, last but not the least, this transverse ligament that we discussed earlier in the lecture, the suprascapular ligament, the transverse scapular ligament that was converting the suprascapular notch into a foramen. So I think that's it. That's all I wanted to talk about the scapula. So I will just show you the slides. These are mostly the pictures from from the Moore's KLM's clinical anatomy. You can pause the slide here and revise your. This is a picture from Netter's atlas showing the ventral surface. Again, picture from Netter atlas showing the dorsal surface. Netter's atlas showing the ventral surface for the muscle attachments. And this is the dors. Okay, and okay, I missed the picture from the dorsal surface, but you can get it from Netter. Let me add it to the video. Give me a second. Here is the picture from the dorsal aspect of the scapula showing the muscle attachment. You can pause the videos here to get to revise your content. I will upload the slides to the website also. So here is a little quiz for you. This first from the Gray's Atlas Students Flashcard. Another one, and these will be the pictures from Moore's Clinical Anatomy, showing you the muscles that are originating from the different um, origin points: trapezius, latissimus, levator, rhomboids, sits muscle, deltoid muscle. You can pause this slide across the way as you read from your textbooks. Oh, yeah, that's the one thing that I wanted to discuss right here. Okay, we have discussed, I think, the latissimus dorsi covering the inferior angle. And here, okay, that's it. These are the different pictures that will help you. So I will be concluding my lecture here. Thank you so much for listening to me. If you have any questions regarding the subject matter, any subject suggestions or feedback regarding the quality and format of the video, please do mention in the comments. Inshallah, see you in the next lecture. Till then, goodbye, good luck, Allah Hafiz.